Get pregnant. Your digestive symptoms, they're IBS. Just sympathy pains.
Some of the most obscene claims I've had thrown at me by gynecologists. Number 1.
Get pregnant. Look, I know you're waiting for your Prince Charming, but I'm telling you, he's not out there. The only way to treat endometriosis naturally is to get pregnant.
I'm not even going to dignify that one with a response. So let's just move on, shall we? 2.
You know, I think the symptoms that you're describing that you say are awfully similar to your sister's who has endometriosis are just sympathy pains because you feel for her condition.
Besides being one of the most ridiculous rebuttals I've ever heard, and it probably being the first time and not last I've wanted to take a swing at a gynecologist, endometriosis is genetic and has been known to exist within the family for decades. 3.
I'm going to request a pelvic transvaginal ultrasound because that will show us if you have endometriosis.
Endometriosis is rarely picked up on ultrasound because the medical staff lack the training to be able to detect it. An actual nurse that performed an ultrasound on me for the detection of endometriosis said I wouldn't know how to look for it. They don't train us for endometriosis. 4.
I don't know where you've heard that from because digestive symptoms aren't endometriosis. That's IBS.
The GI tract is one of the areas of the body that endometriosis is known to affect, causing a multitude of symptoms, from severe abdominal bloating, constipation, and rectal bleeding. 5.
You say they found endometriosis on your bowel during surgery. Now that's pretty surprising. Endometriosis on the bowel is very uncommon, rare even.
Now if you perform a little Google search, you'll read that bowel endo is one of those rare occurrences. But if you're in touch with the thousands of women with endometriosis, you'll hear reports of bowel symptoms in their masses. The bowel is one of the most common organs to be affected by endometriosis, outside of the pelvic reproductive organs. 6.
Your clear negative colonoscopy rules out endometriosis of the bowel.
Colonoscopy isn't the best nor the most accurate method for diagnosing endometriosis of the bowel. It has even been considered useless in the identification of bowel involvement in deep pelvic endometriosis. 7.
Look, if you had endometriosis where you're describing your upper abdomen, rib cage, chest area, you would be coughing up blood.
Are you coughing up blood? Hemoptysis, or coughing up blood, is one possible symptom of thoracic endometriosis. It's not a dramatic episode and instead usually involves your saliva or phlegm streaked with small amounts of blood, typically synchronized with ovulation or your period. The most common symptoms of diaphragmatic endometriosis include pain in the upper abdomen or lower ribs, discomfort when coughing, throwing up, and nausea. 8.
Look, excision surgery for your deep infiltrating endometriosis won't make much change. If anything, the scar tissue alone will leave you in a much worse situation. My advice? If you want to have children, try to conceive now.
I would say it depends on the surgical team and their ability to handle and treat endometriosis. Yes, surgery has risks and can result in scar tissue. But it's also true that excision surgery is the gold standard for endo treatment. When performed by competent endometriosis specialists with minimal disruption, surgery is known to improve a patient's quality in life and in some cases even their fertility. Now that's my roundup. Surely you've had better. What tall tales have doctors tried to feed you? Let me know in the comments.